Thank you, Fauzi. Good afternoon, ladies and gentlemen. It's a great pleasure to be back at IFPRI again. I'm on a 3-month experiment to see if I can speak without PowerPoint. So I don't need PowerPoints. You can tell me at the end of this talk whether I succeeded or not. I'm going to give you an agriculture perspective to this issue of agriculture, nutrition, and health. You've heard from the nutritionists. If I turn this off, will it stop that?
Yeah. They'll switch it.
You've heard from the nutritionists and you've heard from the health people. And what I'd like to talk about is what are the nutritional consequences of agriculture development and agriculture development policy. And that's an issue that all of us are concerned about, and we've been getting a lot of messages around how we can work together. Let me start by reflecting on the Green Revolution. If you talk about the Green Revolution, even if you just mention the word Green Revolution, you'll hear as much blame as you'll hear praise in terms of the nutritional outcomes. And I would say that both sides are true. It just depends on what you mean by nutrition. So let me say that to me, nutrition encompasses the complete spectrum of the word itself. So nutrition is undernourishment, the whole issue of hunger and reducing hunger. It's micronutrient malnutrition, the hidden hunger concept, and unbalanced nutrition, the emerging issues around obesity, etc., that Kaba talked about. So one needs to say, what were the impact of the agriculture productivity experience that we've had over the past 5 decades across all of these factors? And if you look at undernourishment, if you look at hunger, there's been enormous progress that's been made in hunger reduction. Yes, we still have a lot of hungry people, but imagine what the situation would have been like without the Green Revolution. And I think that's something we should be absolutely proud of, and we should keep celebrating that every time we get a chance. And we shouldn't put that under the carpet, because then we are doing a disservice to the work that's already been done to get us to where we are today. That's a really important issue. And how did that come about? It came about because of productivity improvements. It came about because of drop in real prices of food, and therefore improved availability, access to the very poor. But the Green Revolution also contributed to some extent on the malnutrition story, on the micronutrient malnutrition. And the way it did that is by reducing the prices of staple calories. The poor had much lower share of their total expenditures that they needed to use for meeting their calorie requirements, and some of the savings were then diverted to micronutrient consumption. So if you look at Bangladesh, and if you look at the nutritional surveillance project of Bangladesh, then it's quite clear that because of the drop in rice prices, there was an increased consumption of micronutrient-dense food, especially vegetables. And that then translated into children who were nutritionally much better off in terms of their micronutrient status, etc. So there's quite a bit of good news stories around the Green Revolution. But it's also very, very clear to all of us who've been working on the Green Revolution for decades that the Green Revolution has had serious problems associated with nutrition itself. And the serious problems is that the focus was very much on staple crop productivity improvement. The focus was very much on calorie availability and improving calorie access. And therefore, what can we do today that will correct some of those imbalances that were created? Let me list some of the areas where I think the problems were. I think one of the first problems the Green Revolution created was it crowded out production of non-staple crops in areas of intensification. So if you take India, when the rice and the wheat Green Revolution took off, basically pulses disappeared from those areas. Legumes disappeared from those areas. That was a huge problem. And the relative prices of staples to non-staples changed quite dramatically. Non-staple prices went up extremely high relative to staples, and that had an immediate and long-term impact on access to micronutrient-dense food, etc. The second problem that took place was, with this focus on monoculture, intercropping systems disappeared. So think about Mexico. Think about the milpa system in Mexico, which traditionally was a system of maize, beans, and squash all grown together on the same plot of land. The milpa system very quickly gave way to monoculture hybrid maize systems. And again, the consequences are very clear. We've seen also a dramatic drop in the supply of indigenous vegetables, indigenous fruit, and the demise of wild food that's harvested from agricultural lands. So in the Philippines, the poor would harvest wild leafy vegetables and fish from rice paddies. But as the Green Revolution progressed, the opportunities to harvest this wild food was very limited. So all of these changes that came about were changes that came about because of the focus we had on rapid food crop productivity improvement, and the policy infrastructure, the physical infrastructure, the institutional support, the credit systems, the extension systems, all of these were unilaterally focused on staple crop productivity programs. That was not wrong, but what it did is that it created an undervaluation of a more diversified production system. And that's, I think, the key for us to look at as we think about what do we need to correct in terms of the contributions of agriculture to improving nutrition. Then in terms of the emerging nutritional problems today, hunger, poverty are still such big persistent problems which we need to address. But importantly for us as we look ahead, the geographic concentration of hunger and poverty is much, much sharper today than it was in the 60s and in the 50s. So we can still look at opportunities for hunger reduction, poverty reduction, and having positive nutritional outcomes come in. But at the same time, as Kaba pointed out, there are new nutritional problems coming up. The whole issue around obesity and diet-related diseases. This is a big area of something that we've not been talking so much about. But it's an important problem even in countries where hunger is a big problem. Even in societies where hunger is a big problem. You're beginning to see the coexistence of hunger and obesity coming together. And there's several reasons for this. But part of the reason for this is that high energy, high fat diets have become extremely cheap today, even in very poor societies. So think about India. Compared to 1960 to today, a diet that's 20% fat content diet is about half the cost it was in 1960s. So for very poor people, the opportunities for getting a high-fat, high-energy diet is much greater than the opportunities for getting a micronutrient-dense diet. And I think that's something we need to look at. And the important point for us is agriculture policy has as much to do with these current and emerging nutritional problems as the problems of hunger that we addressed in the past. So let me give you my wish list of 5 big things that we should be doing in terms of R&D and in terms of policy. I mean, let's be very clear. Staple crops will continue to be a very important part of the diet as long as we live and as long as our grandchildren live and way beyond that. So it's not a question of us saying, let's get out of staple crop production. I don't think that should be a message to anybody. And for the very poor people, a large part of their diet will be staple crops. So biofortification continues to be a high return strategy. The work that's going on that Murray talked about in terms of orange flesh sweet potato and the immediate gains that we've seen for populations in Mozambique, etc., this is an enormously important activity to think about. Similarly, the work that IFPRI is doing on golden rice can have huge impacts on vitamin A in rice. That's one set of breeding issues that continue to be important. But then let's look at other opportunities. Let's take a systems perspective to promoting intensification. Is there a way in which we can improve the intercropping of a staple and a legume or a pulse crop? Is there a way in which we can improve the growing of a rice or a wheat crop followed by a non-staple crop? We need to find these opportunities. Now, it's easy to say that we should promote it, but it's very difficult to move the current food production systems, which are so staple crop oriented, to take a broader perspective where farmers have the flexibility of crop choice. If we can design an intensification system that has all the components in place, but leave the choice of the crop to the farmer, we will then see a very different production system in place. Staples may still be the most important part of it, but the level of diversification would be much greater. I hope IFPRI can look at this issue. I think IFPRI needs to really ask itself, how do you create a crop neutral system of intensification? The fourth area that I want to bring up is the whole issue of non-staple crop livestock value chains. And here the issue is not so much that the value chains are important. Yes, they are. What's important is how do you get smallholders to link into these value chains? What are the transactions costs involved in terms of access to production, technology, information, but also in terms of standards and qualities that need to be met? Those transactions costs. An important part of going into the value chain for smallholders is risks and managing risk, both production and price risks. And here, very little work has been done looking at non-staple crops. The last area, I know I'm out of time also. The last area is on food safety. It's been brought up before. Food safety is absolutely important, not just from a health point of view, but from a nutrition point of view. Increased incidence of foodborne diseases, pathogens, mycotoxins, etc., actually have direct impact on nutrition because they reduce the nutrient uptake into the body from the foods that are consumed. Aflatoxin, for example, IFPRI's work today has shown that you lose about 36 million dallies per year from aflatoxin contaminated maize and peanuts. If we can address the problems around food safety in a way that smallholders and the poor can have better access to safe food, we are making major contributions to improving food security and improving nutrition. These are areas that we should be integrating much more into the nutrition discussion that's taking place. And finally, as I close, let me say, I'm with Kaba when he talked about the silos that we're all in. I'm in an agriculture silo, there's a nutrition silo, there's a health silo. But you know, the problem of malnutrition is too important to be caught in our disciplinary silos. and it needs to be addressed by all of us comprehensively. We need to bring together our collective experience, and we need to do it now if we hope to have any impact on the lives of the very poor. Thank you very much.